Thank you for joining us this evening. I'm Christy Brown, a member of the board at the Medical College of Wisconsin and CEO of Girl Scouts of Wisconsin Southeast. This is our weekly community town hall held each Monday at 6 p.m. I want to say on the front end that you can submit your questions in the question panel at any time throughout this presentation. In addition, the PDF of the slides are available in the handout section of the control panel. Our goal is to bring the community up to date, accurate information, and to answer questions to ensure that you can take the best care of yourself and your family. We ask that you help us with this and share the information you get here, access the information on our website, and make sure that this critical information is reaching the people who need it. Tonight, we have quite a slate of panelists to bring you expert perspectives, key information, and to answer your questions. Dr. John Raymond, President and CEO of the Medical College of Wisconsin, Dr. Veneshia McKinney, Assistant Professor at the MCW, Director of Community Medicine and Director of Maternity Care, All Saints Family Residency, Dr. Kristen Bunnell, Assistant Professor of Clinical Sciences at the Medical College of Wisconsin School of Pharmacy, and finally, Anna Benton, Deputy Director, Division of Medicaid Services, Wisconsin Department of Health Services. Dr. Raymond. I think you're muted.
Okay, thanks, Christy. Thanks for the reminder. And good evening, everybody. This slide shows the daily incidence of positive COVID-19 tests in Wisconsin. And as you can see, our tests seemed to plateau early in April and then started to rise again with what looks like a new plateau. A couple things worth noting here. Our testing capacity significantly increased starting in the last week of April, now being over 4,000 tests administered per day and a total capacity of about 14,000. And we hope that the testing will increase. Now, just in terms of the positive tests, some of that is due to the increase in testing, but we also think some is due to institutional spread of COVID-19 in food processing plants and in nursing homes. Next slide, please. This slide shows some various trends for COVID-19 in Wisconsin and in Milwaukee. We study the doubling time, which is the amount of time that it takes for the current number of cases to double. And those have been extending out from about 3 days now to 15 days in Wisconsin and almost 19 days in Milwaukee. So that's good progress in flattening the curve. Daily growth rates over the last 7 days are holding relatively steady at under 5%, at 3.4% in Wisconsin and 2.9% in Milwaukee. In terms of positive tests, we had 6.5% positive tests in Wisconsin and 12.5% positive tests in Milwaukee. In terms of the positive test numbers, we actually had the lowest number of positive tests this month, with 199 in Wisconsin, 70 in Milwaukee, and 27 in Brown County. And as I mentioned earlier, we have a testing capacity of about 14,000 in Wisconsin, and that's been stable for the last 2 weeks. We also monitor intensive care unit and ventilator capacity, and those are stable and they're adequate. Finally, we monitor personal protective equipment trends, and those are improving slightly or stable depending on the hospital system in Wisconsin and in Milwaukee. And the most acute shortage is in hospital sterile gowns. Next slide, please. So this slide shows COVID-19 daily testing. I already gave you the numbers, but these show the trends since April 27th for tests in Wisconsin on the left and tests in Milwaukee on the right. The pink bars show the number of positive tests, and the teal bars show the total number of tests on any given day. The black line shows the trends for the percentages of positive tests. And we would like to see those trend lines going down maybe a little faster than they are right now, both in Milwaukee and in Wisconsin. Next slide, please. So for this next slide, I just want to show you an example of infographics that Medical College of Wisconsin and community experts have developed so that they can serve as a resource for you. And you can download those at COVID-19 covid19.mcw.edu. And please do and share this information with your friends. Thank you very much, and I'll turn it back over to Christy.
Actually, excuse me. I think Dr. McKinney is next.
Next slide. Thank you, Dr. Raymond. So with COVID-19 testing, there's two types of tests. You have your viral and your antibody test. The viral test checks samples from your respiratory system and tells whether you've been infected with COVID-19. These tests are becoming more widely available, so you can call your doctor to request a test or call 211 if you do not have a doctor. The antibody testing, this test is not widely available in Wisconsin just yet, but this test tells you if you've already had COVID-19. And we don't know just yet if having antibodies to the virus can protect you from getting it again. Some viral testing tests are point of care tests with results available at the testing site in less than 1 hour. Other tests can be sent to the laboratory and the results are resulted in 1 to 3 days after they receive those tests. Next slide. So testing prioritization. So we have high priority and priority. High priority would be your hospitalized patients that have symptoms, also healthcare facility workers, workers that are congregated in living settings, and first responders that have symptoms. Residents in long-term care facilities and other congregate living settings such as prisons and shelters with symptoms. Priority would be persons that have symptoms of COVID-19 or persons without symptoms who are prioritized by their healthcare department or by physicians for any reason. Next slide, please. So should you get tested? If you have symptoms of COVID-19, please call your healthcare provider. If you meet the requirements for testing, you'll be directed to a testing site. No symptoms are cough, shortness of breath, or difficulty breathing, or at least 2 of the following symptoms, which include fever, chills, repeatedly shaking with chills, muscle pain, headaches, sore throat, vomiting, diarrhea, or a new loss of taste or smell. Next slide. Next slide, please. So testing for minority populations. So the state is offering free testing for minorities who are asymptomatic without symptoms of COVID. We know that African Americans and Latinos account for half of all the COVID cases here in Wisconsin. Latinos make up 7% of the state's population, but account for 29% of those cases. African Americans make up 6% of the state's population and accounts for 21% of the COVID cases. 31% of Wisconsinites who have died from COVID-19 are African Americans. Next slide, please. So for example, at my office, which would definitely be, is not the standard for all offices, but my office is currently providing tests for our patients. And how this works is our patients have to have a virtual visit first, whether that's telephone or by a video chat. And then after discussing with the patient, the physician will determine if a test is appropriate. At that time, we'll schedule an appointment for them to have testing right at our office. They're registered on the phone, they arrive and they stay in their car, and our staff goes out to their car and collect the sample. And then we later contact them with those results. So now I'll pass it over to Dr. Kristen Bunnell. Next slide.
Dr. Bunnell, I believe you're muted.
Thank you very much. So one of the things that I really wanted to highlight for our audience members are that pharmacists are among the most accessible healthcare providers, and this is something that my colleagues and I at the School of Pharmacy really like to emphasize, in the sense that at any given time you could walk into a community pharmacy or call a community pharmacy, and without a prescription you could talk to a pharmacist who is someone that's received advanced training on safe and effective use of medication. So I think in addition to some of the testing considerations that we'll talk about today, providing accurate drug information is also a potential role of the pharmacist during this time. Because pharmacies are essential businesses, they have remained open during the COVID pandemic. And so the Centers for Disease Control and Prevention have made some recommendations in order to keep both our pharmacy personnel and our patients safe. So some of the recommendations that the CDC have made are to wear face coverings while you're inside the pharmacy. So this is similar to other situations where social distancing may not be as feasible. So if you're in a pharmacy, please do not be concerned if you see your pharmacist or your pharmacy technicians wearing masks. Another potential recommendation is that you obtain your prescriptions through non-conventional sources other than going inside the pharmacy, such as mail order or drive-through prescriptions. Sometimes pharmacies that don't specifically advertise that they have mail order services can mail you your prescriptions if you ask, so it's always good to have a conversation with your pharmacist. Another recommendation from the CDC is to consider deferring routine vaccinations, and I would certainly caution you that that does not mean that all vaccinations should be deferred, but the recommendation is to have a conversation with your healthcare team, including your pharmacist, to see if that vaccination is necessary during this time or whether it could be safely postponed. Next slide, please. So as I mentioned, one of the roles that I really wanted to highlight during this time is the pharmacist's role in providing accurate drug information. And pharmacists can work in two different major settings, one being the outpatient retail pharmacy setting and one being inpatient, meaning at a hospital setting. And my colleagues that work in retail pharmacies have said that they have fielded a lot of questions from patients about over-the-counter medications, herbal supplements, hand sanitizers, and disinfectants, particularly as there have been shortages of some of these items, and they could potentially be compounded by pharmacies. Managing their chronic medications, there have certainly been some questions about the safety of chronic medications during coronavirus, and as well as the refills for chronic medications. So some of my colleagues are engaged in collaborative practice agreements that allow them to work with the treatment team in order to make sure that patients do not run out of refills during this time when it may be challenging for them to see their regular provider. My current practice is on the inpatient side at Froedtert Hospital, and so I wanted to highlight some of the things that our inpatient pharmacists have been doing in terms of the coronavirus response. And one of those has been collaborating with a large team of other providers, including our infectious diseases physicians, our lab personnel, and our infection control personnel on institutional treatment guidelines. And one of the other things that our team has really done is getting questions from our frontline providers about medications and the role of medications in treating coronavirus. So as you can imagine, sometimes when you're actually taking care of patients all day, it can be challenging to keep up with the amount of information that's coming out every day. Froedtert actually has an entire team dedicated to answering drug information questions. So the team that I wanted to recognize is the Center for Medication Use team, which is a team of drug information pharmacists, and they get questions from providers, usually emailed to them, and they provide written evidence-based responses to those questions to kind of help guide care as it arises day to day. So those are two potential roles in terms of drug information. Next slide, please. And finally, I wanted to address the pharmacist's role in COVID-19 testing. And one of the recent changes in the COVID landscape is that Wisconsin pharmacists are now authorized to order and administer COVID-19 tests. And that does not necessarily mean that you can go to any pharmacy and be tested for COVID-19. Most of the pharmacies are providing this by appointment only and as a drive-through testing strategy. And in addition, most of the sites now, although pharmacists can potentially administer nasopharyngeal swabs, most of the sites are now having pharmacists oversee the self-administration of a nasal test and doing the rapid viral testing on site. Now, one thing that I would say is that this is definitely a process that is very early on. It's still evolving. I think many of our pharmacies will probably start testing more in the future. I do not have a personal affiliation with any of these pharmacies, but I just wanted to note some of the retail pharmacies in our area that are providing these services now, one of which is Walgreens, which has at least one site that does provide drive-through testing at no cost to eligible patients. Some of our other major chains, such as CVS Pharmacy and Kroger Pharmacy, are in the almost end stages of rolling out some of their testing initiatives. So I think there's probably more to come in terms of pharmacy-based testing, particularly as we get further along into the COVID-19 pandemic. And with that, I will turn it over now to Anna Benton.
Thank you, Dr. Bunnell. So I'm going to talk a little bit about the statewide initiative to do with testing and also our local initiative. Next slide, please. So as you probably heard, Governor Evers has been talking about the Badger Bounceback plan, and the goal is that every Wisconsin resident who has symptoms can get tested. And that will probably be about 85,000 diagnostic tests per week, which equals about 12,000 per day. And just as a point of reference, we're currently doing around 5,000 per day, so we have a little ways to go. Another goal is that the results are reported to the patient and to public health within 48 hours. Next slide, please. Last week, it was announced that the state will be testing or helping local public health test every single nursing home resident and staff member in the state. So that is a big job. We're doing about 10,000 tests per week with this. All 373 nursing homes will receive free tests. There are 34 nursing homes in Milwaukee County alone. Next slide, please. Another thing that the state has been sponsoring is National Guard assistance. So right now we have 15 specimen collection teams, that's around 500 National Guard members operational across Wisconsin, boosting local and state testing capacity. And I believe there will be more teams coming online to help. So those teams are supporting mobile testing events, such as the ones we're having in Milwaukee right now, which I'll talk about in a minute, but also testing at strategic locations like correctional facilities, nursing homes, congregate care, living facilities, health clinics, and workplaces where there are outbreaks. Next slide, please. So as mentioned, and hopefully you've all read about this in the news, there were 2 testing sites started up today, one on the north side of Milwaukee, one on the south side. They go from 8 a.m. to 8 p.m. They're going to be open 7 days a week. And we have the capacity at 500, but I actually think the sites were so busy today and the Guard members worked so hard and they opened up 3 lanes instead of 2 at each of the sites that they probably did more than that. We'll see. We'll get the first test numbers at 10 o'clock tonight. What's interesting about these testing events is that there are no appointments or pre-registration necessary. Next slide, please. The other interesting thing is that they are open to all. So every other testing site that I'm aware of, you do need to have symptoms in order to get tested, and you do need to have an appointment. With these testing sites, open to everybody, no one turned away, doesn't matter where you live or what your status is in any way, it's completely free. You can drive up, you can walk up. We are recommending that people who have symptoms avoid public transportation and that everyone wears masks when they come to get tested. We're aiming to get the results back in 2 to 4 days. Those will be phone calls either from National Guard or from local public health. With such a huge demand that we've seen today, it might be pushed back to 5 days if we have to, but we'll do our best to get the results out more quickly than that. Next slide, please. So to bring it back a little bit, we're going to talk about the Milwaukee Expanded Testing Initiative. This initiative started up 3 weeks ago, and it's an initiative that I help co-chair along with Dr. Parity, who was on this town hall last week, Joy Tapper from the Milwaukee Healthcare Partnership, Dr. Ben Weston, who you're probably familiar with. He's on television most afternoons, and Steve Gordetsky. And our membership is a nice sampling of folks from the healthcare sector as well as public health. Next slide, please. The goal of this initiative, which started 3 weeks ago, is to expand Milwaukee County tests to at least 2,000 tests a day. Right now, we're about at 500 per day. When we hit 2,000, we actually think we'll probably need more tests than that in order to really get this in check. So we're going to be looking at some secondary measures, and we might move the goalposts a little bit and boost that number of tests per day as a goal. Our other goals are to provide equitable access to testing, to connect tested patients to follow-up care and social supports, ensure timely collection of all the demographic information, and to do really good public monitoring and reporting of data. Next slide, please. We have 4 strategies that I'm going to talk briefly about. The first is our place-based testing. So this is using not just the GARD, but also other resources like EMS or fire department, healthcare providers, or when there are outbreaks. So that could be congregate housing, that could be workplaces, that could be provider sites as needed, and in future, we might get into schools and community centers and others. Next slide, please. The process for calling in assistance for these place-based testing initiatives are to contact the local public health department, and they will shepherd the request up through the County Unified Emergency Operations Center and up to the state. We're putting in place a pretty detailed flow chart of how these requests should go so that everyone is aware of that. So far, we've supported over 10 facilities and workplaces with outbreaks in Milwaukee County to date. Next slide, please. Strategy B has been where we're putting probably most of our efforts. So this is expanding healthcare provider testing. This is not just our community health centers, although they were the first to really get up and going, but also our health systems, the ambulatory centers and the clinics, and other provider sites. And I think if we go to the next slide, we will see a map. This is an interactive Google map where you can see all of our provider-sponsored testing sites. The best place to find this map, although it's popping up in many places, is on 211 Impact. So, and the map will be kept updated. If you click on each of the locations, it'll come up with the phone number and the rules and appointments needed, open 7 days a week, that kind of information. Next slide, please. Strategy C is our community outreach and education. So this is just really telling the community what we are doing. So lots of messaging. We've worked very closely with 211 to make sure that they're giving out the right information to everyone. We've got social media campaigns. We have the website and interactive map that you just saw. We're developing lots of materials and getting the word out, sending out flyers to all of our Medicaid members, working with some marketing firms on paid media and earned media. So I'm sure you'll see some of that in days to come. And strategy D is our measurement and reporting strategy. And this is really just testing and data and making sure that we're capturing outcomes and that we're sharing those with the public. So I think if we go to the next slide, we'll see our public testing dashboard, which was stood up about a week ago. And this is on the Milwaukee County website. It's fairly easy to find if you look for it. Most interesting to me, all of it's interesting, but that bottom left hand is the total tests performed per day. We want to see that number going up into the green zone. Not quite there yet, although the numbers there we realize today are misleading as some of the testing data is getting stuck in our what we call our WEDS dashboard. Anyway, that's behind the scenes, but look to see those numbers going up. It needs to hit that 2,000 a day. Next slide, please. So what are our next steps? Next steps are to really help coordinate the place-based testing sites. I mentioned we'll have a really detailed flow chart of how those requests will go. We're helping oversee the rapid deployment of the National Guard to facilities. We're promoting the community health center and health system testing sites, developing those campaigns, continuing to add good data to the public-facing dashboard. We're also addressing transportation challenges. We're looking into ways that we can get people rides to these testing sites so that they don't have to take the bus, which we discourage. I just wanted to mention too, it's not part of our purview, a little bit outside our scope, but it's very, very closely related. We want to make sure that we're doing effective contact tracing measures. This is something that the local health departments are responsible for. And essentially, whenever anyone tests positive, the health department will call and they will ask you who you've been in contact with for a certain number of days. And then they'll call all of those folks and ask them to quarantine as well. And it's really important that people cooperate with those contact tracing efforts. We're also going to be looking at the antibody testing as it becomes more available. And as was said earlier, not very widely available right now. Not something that a lot of people are getting, but it is coming. Next slide. Was it for me? Thank you.
Okay, we will open it up to questions at this point. If you have any questions, hopefully you've already put them into the chat box or in the questions box in the control panel. If you've not yet done so, please do so at this time. We'll have a moderator who will be sharing the questions with us, and our panelists will respond.
Yes, thank you. We have been receiving a number of questions, so please do keep them coming so we can get to as many as possible. I do also want to mention that there are 2 handouts available in the handouts section of the control panel that you can download these slides and also get other supplemental testing information as well. So we have a number of questions coming in regarding masks. I suspect with the beginning of the relaxing of Safer at Home and other things going on there, like the Badger Bounceback program, we have lots of people wondering things. So let's start with this. There is much confusion about masks. Many think cloth masks are not effective in protecting the wearer. Can you address this?
I'll start. Cloth masks are moderately effective in protecting the wearer. That really why you would wear a cloth mask is to protect other people that you might come into contact with in public. Now, some cloth masks, especially those that you could put another mask in as an insert, might give you a little bit more protection, but it really is a courtesy to the people around you.
How far into the future do you believe we will need to wear masks out in public?
I'll start, I would say, until we have an effective vaccine. And again, as we get farther into managing the pandemic and people have lockdown fatigue, I think there's going to be a real problem with compliance. And I think that people that are going to be serious about wearing masks all the time may eventually be in the minority. And we're going to continue to encourage the wearing of masks until we have an effective treatment or a vaccine.
Next question on masks. How often should we wash our masks? How many should each person have?
Anna, do you want to take a stab at that?
Nope, I'm not the MD, sorry.
Well, I would say that,
I can take that.
okay, great. Thanks, Vinny.
Okay. So right now, what we're telling our patients is if you have a cloth mask, if you could wash it every day, which has been a hard thing to do, but it's worth it. So we have really been pushing our patients to try to wash them every day. And with that being said, having, a couple of masks that they can, filter, go through every, they can swap out every day. There are some solutions like peroxide mixed with water that we have been trying at our office for just our providers, and that's been helping as well, just to cut back on the washing. But I would say definitely it's some stuff on YouTube, like putting your mask in the microwave. I would definitely advise against that.
Thank you. And a follow-up to that, how many times should I wear my mask before I wash it? So what frequency should we wash them at?
I can take that one. I would say daily, but if it gets soiled or it gets wet, then you should, wear a new mask.
Okay, thank you. Next one is my sister is having her wedding later this summer. If she is able to have it, should everyone there wear masks? Only some people? How careful do we need to be?
It's probably going to be a personal choice, but I would, if it were me, I'd wear masks and I would maintain as much social distancing as possible, especially if you're going to have people coming from out of state and other communities that don't live in your home normally. You're going to be interacting with a lot of new people, and that's probably a high risk situation.
So what Dr. Raymond said is that if people are coming from different states, different cities, and they're flying, they're going to be exposed to a lot of people as well. So I would definitely, still practice social distancing and definitely wear a mask.
Thank you. And related, another question. We have 7 young grandchildren and miss them very much. Can you envision any safe scenario in which we might visit with them this summer? It might kind of piggyback on the previous question's answer.
Well, that's a good question. I guess it depends on what you mean by safe. That's a toughie. But if they're kids that are generally not interacting with other children, that's probably safer. So some people are saying that you probably should do it before kids go back to school. Dr. McKinney looked like she wanted to, it's probably a question you get asked all the time.
Yeah, so yeah, it's really hard to say, but I think like what Dr. Raymond was saying is you have to define what safe is. Safe now is different than what we thought safe was a couple of months ago. So yeah, I think I would agree with him that, if you really want to see your grandkids, it would be nice to do video chat. But definitely if that is not an option, I would say you should probably before they go back to school. Because once again, you have different people coming all together in one place and you don't know who they have been around. So I would agree with Dr. Raymond.
I saw someone wearing a face shield out in the community. Is this something that more people should be doing?
I would say, so the face shield, I guess if they're trying to protect, I don't know. I would have to, Dr. Raymond, what do you think about that?
I've heard a lot of people say that the face shield's better, that it may give you a similar amount of protection, but it's better at protecting other people around you. And for people that wear glasses, it might be more practical because the face shield doesn't fog up as easily. It's just harder to come by a face shield than it is a mask or cloth face covering.
If a mask only is there to help protect others, what should I do to protect myself?
I'll go back to the mask may give you a small amount of protection, but protecting your 6-foot personal space bubble or maintaining that 6-foot distance between you and people that don't live in your home or people that might be sick is probably the best thing you can do. And frequent hand washing. Be careful when you're touching public touch surfaces like elevator buttons and ATM buttons and things like that. Make sure that to the extent you can, you wash your hands before and after touching those surfaces.
And I guess I would piggyback that, like keeping sanitizer or just washing your hands. Try not to put your hands to your face if your hands are soiled. And the main thing is, we always think about washing our hands before we eat, but washing your hands after you eat. Just if you think about it, possibly wash your hands. And I think that's the best way that you can keep yourself safe as well as your family. And definitely staying away from people that aren't necessarily in close contact in your home. So if you are with your family at home, that's one thing, but trying not to go to places where there are a large amount of people that are there. And I would say the grocery store is one of those places. So make sure when you go into the grocery store, you still are practicing social distancing. I don't think I know I recently went to the grocery store and saw people like wearing gloves, which it really is, if you're going to wear gloves and then after that, you're going to go into your purse and then open your door and get in your car, the gloves are not serving you. So I would just say definitely wash your hands and then just practice social distancing while you are in those places where there are a lot of people.
Okay, thank you. I did receive a follow-up comment regarding the face shield from someone that I thought I'd pass along, pointing out that the face shield also allows people who read lips to assist in communications more so with others. Okay, there's some questions about the vaccine. So it was mentioned that it might take up to 18 months. Why will it take so long to develop and create a vaccine for COVID?
I can speak to this one. I think, a big part of what takes so long for vaccines to come to the market is the amount of safety testing that they need to do in terms of giving larger groups of people so that we can start to see safety signals as well as the efficacy. So it's really the amount of testing that goes into the process as well as the amount of research that goes into finding the candidate vaccines in the first place.
And I would add to that, it takes a long time to be able to scale up the manufacturing and the distribution. Those are not trivial, and they take months to years and under even the best of circumstances.
Next question, what are the recommendations for pregnant women? Is there indication that having COVID will impact the baby at all?
So this is a great question. Right now, what you will find is COVID is something that is ever evolving. We're learning new things every day that we necessarily didn't know that we would know or wouldn't know. So in regards to being pregnant, we don't know if it will affect the baby. Right now, we do not believe it will, but just because we don't know, it's good for you to do all the preventative things that we discussed earlier.
Have there been many children diagnosed and or treated in Milwaukee or Wisconsin? How many or what percentage?
I don't have a definite answer, but I know that there have been some, but just a few at Children's. And they're being very at least as careful with family members that come into the patient care environment as well, but not very many. But I know everybody's probably concerned about the reports from New York about the multi-organ inflammatory syndrome that may be associated with COVID in children. So that's a new concern.
Okay, thank you. There's some questions regarding the testing events that were mentioned. What type of COVID-19 tests are being used at those testing events this week?
So all I can tell you about the type is that they are from Exact Science. Exact Science is a firm that has stepped up and put aside its regular product in order to help the state, and it's giving the state 40,000 tests each week. So that is the test kit that is being used by the National Guards.
It's a PCR test, so it's the test for the RNA from the virus. So you would expect that to be positive during an infection that's active.
And then a follow-up, it was mentioned that antibody tests are not widely available in Wisconsin as of yet. Why is this the case, and when should we expect them to become available?
I'll start, and people may disagree with my opinion. A lot of the antibody tests on the market aren't very good. They have a high false positive and a high false negative rate. And people might be familiar with some of the studies from California, from Santa Clara County and Los Angeles. They used flawed testing kits that had a high false positive rate. And so it exaggerated the number of positive cases in their communities. The new tests that are coming out from Quest Laboratories, from Roche, and from Abbott are actually very good. They're highly sensitive and pretty specific. They have a very low false positive rate, like 4 to 6 out of 1,000. And those are inexpensive and they're quick. So hopefully those will be coming on the market within the next month or two. I know that Wisconsin Diagnostic Laboratories and the MCW faculty in our Department of Pathology have both the Abbott and the Roche platform for the antibody tests.
Okay, thank you. This next question is, I think I have symptoms of COVID. Will the test center tell me if my symptoms are indeed COVID-19? Should I get a test to see if I'm immune after I have recovered? What is the likelihood I will be immune?
I can answer the first one, but sorry, not the other ones though. The testing center will not tell you whether or not you have COVID-19 when you are right there. And for most of the testing centers, the provider-based sites, you do need to call ahead of time. You'll be speaking with a nurse. You can go over your symptoms then, and they'll recommend whether or not you should come in for a test. And you will get your results a couple of days after that. So, Dr. McKinney?
Can you just repeat the second part of the question?
Sure. The second part is, should I get a test to see if I'm immune after I have recovered? What is the likelihood I will be immune?
So, so the thing is, right now, like we said, the antibody test is not widely available right now, and as Dr. Raymond said, is probably not the test that's currently on the market isn't as sensitive or specific as what we would want it to be. So there is some test strategies. So if you were positive for COVID-19, and then later on, after your symptoms have resolved, we go by two testing strategies where you will be tested again with the viral test, or you could do a home-based test, or not a home-based test, a strategy test where your symptoms resolved. So after 10 days of your symptoms, 10 days after your symptoms started, and then 3 days or 72 hours after you have been afebrile without having to use any anti-fever medication. So as of now, I would say, would you have antibodies? We don't necessarily know. We would hope so, but we don't know for sure if you are affected with COVID-19, if you would definitely be immune to it afterwards.
Thanks, Dr. McKinney. Maybe I would add, the way the question was asked, we have to distinguish, you might develop antibodies. We don't know yet how good those antibodies are to keep you immune from a second infection. We should probably know that in the next couple of months, but we don't know right now.
Okay, thank you. The next question is regarding an individual who took the COVID test almost 5 weeks ago now at a local drugstore, and he's still waiting for the results. Why would it take this long, or what advice would you say that he should do?
Call the store. I think Dr. Bunnell would tell you that that's too long. Even early on, people were impatient after 3 or 4 days. You should be able to get turnaround time within 24 to 48 hours now.
Yes, I would agree with that. Even a send out lab would have come back before that time. So the best thing to do is follow up with the store. They should not really be directing you to contact anyone else other than the store is the main point of contact.
Okay, thank you. Next is, my boyfriend had COVID-19 and has been cleared to return to work. He works on the front line. My mother, who's 65 years old, lives with me. Is it safe for me to spend time with him?
The short answer is yes.
Next is, how much testing is enough? I.e., is there a percentage of the population that we want to test since resources are limited?
I can start that. There really is a wide variety of answers to that. If you look at what the think tanks are putting out, they're all over the map. I read one that said it should be the equivalent of the entire population getting tested every 2 weeks. So huge amounts of testing that we're not even fathoming right now. I don't know what the answer is. I don't know if anyone else has any thoughts on that.
I would say that whatever we're doing now isn't enough, because we don't really have a good idea of how many people in the community have had it and may have antibodies right now. And we probably don't know how many people are out there who are asymptomatic or pre-symptomatic at any given time. And we need that information, especially our public health officers, to make good decisions for us. And I'm excited by the testing initiative that Anna talked about earlier, because we're going to get some of that information because we're going to be doing more testing. And hopefully the way that the tests are designed, we'll be testing the populations that are at a higher risk, especially those from ethnic and underrepresented minority groups that have the disproportionate burden of COVID-19. And I really think that that'll help us make good decisions. And Anna, you probably would also recommend that we should probably be testing more in congregate settings like prisons and long-term care facilities, and industrial settings like food processing plants where people can't really socially distance very well.
Yeah, absolutely. Right now, we're starting in those settings when there is an outbreak, but I could imagine a time in the future where we're just sort of testing automatically in all of those settings.
And one more thing I would add, a lot of our businesses want to do the right thing, and they want to be able to test their employees before they come back to work. And we really don't have a mechanism to help those businesses yet. And one of my hopes is that when we get more testing capacity, that we'll be able to do that as a state and as healthcare providers so that people can have good information about their workers.
Regarding the citywide effort of testing, does this include people who are homeless?
Yes, the city of Milwaukee, I believe, has been doing some work with the homeless population, as well as some of our community health centers have been specifically reaching out to those groups. So yes, there is an effort going on to reach folks who are homeless.
And then it was mentioned about underrepresented populations. This question is, how are refugee populations in Milwaukee who don't speak English, nor Spanish, nor Hmong get access to testing information, especially the community-based testing?
Mm-hmm. So that is something that our group is taking into consideration. We're going to be translating our information into many different languages. Our community health centers are really good at reaching underserved populations, including refugee groups. So we're relying on their expertise in reaching out to those groups.
So in my office, we have a large population of refugees. So what we've been doing is using our interpreter to call. And so when they schedule an appointment, when they see their physician, we're making those tests available for them.
And another question on the public testing, will individuals be able to public test more than once? How will this be managed?
Yes. So at the National Guard sites, as mentioned, they are not turning anyone away. So if somebody has already been tested, they wouldn't even necessarily know that. They would just test them. The community health centers and the provider-based testing, because you would be speaking to a nurse beforehand, would guide you and advise you about whether or not it was necessary.
As was said at the beginning, testing increases the number of cases reported. How can we separate higher reported case numbers due to increased testing from a potential flare-up of COVID-19?
Well, there's been a lot of discussion about that, and Anna's been involved in some of those. That's one reason why we're also following the percentage of positive tests. There's a line of thinking that that's actually a better measure of how you're doing with controlling the pandemic than the total number of positive tests, especially when you have a significant increase in the numbers.
Next question, how does COVID correlate to the general flu that has normally been reported each year? We are not hearing any flu reports such as occurrences and deaths this year because of the COVID reports flooding the news.
I just read that this is a moderately strong flu year and that those are being reported and that it's not getting a lot of press, but there are the Center for Disease Control tracks the influenza every year, and that we're running a little bit ahead of the usual year.
I would just agree with that. So not only am I see patients in the outpatient setting, but I'm also around with the team in the inpatient setting. And so we definitely have had a lot of influenza on our service. It's just that COVID-19 is getting a lot more press than influenza, but it is definitely happening, and patients are definitely affected by it.
There's a question regarding pharmacists. Do pharmacists have provider status in Wisconsin?
So that is a great question. So provider status kind of refers usually specifically to being recognized as a provider, usually in terms of being able to bill many of our government agencies. And so unfortunately in Wisconsin, we do not currently have provider status in the sense that we can bill to agencies like Medicaid and Medicare. But it is something that we are trying to advocate for on a state level because it is very important to our ability to provide services to our patients.
Are there indications that there are drug interactions or that certain medicines make it worse? I've heard that ibuprofen is bad for you if you have COVID.
I can take that one too. I know there was definitely a lot in the media about whether things like ibuprofen were safe to take for patients that had coronavirus. And largely, the larger studies that have looked at this have mostly concluded that it's probably not harmful to take things like ibuprofen and other related medicines, particularly if patients are already on things like that chronically for pain conditions. They should continue taking them. There's not really a signal that they would be harmful, despite some of the initial concerns about that.
Okay, thank you. Next, I keep seeing articles on pulse oximeters. Should I get one?
So I'll start. The thinking about pulse oximeters is that they can detect low oxygen levels. And they're relatively inexpensive and easy to use. And what we're learning about COVID-19 is that people can have lower oxygen levels than we would normally be used to and not really feel that bad. And so some people have recommended early pulse oximetry. I think that you can do that in a clinic setting. You could do it in the urgent care and emergency room. Those are readily available. For home testing, probably not particularly useful, but I don't know what, Dr. McKinney, are you recommending?
Yeah, so no, we're not recommending the pulse ox at home, but definitely we use it in like an inpatient setting and outpatient setting. If a patient complains of shortness of breath, we hook them up just to see what their oxygen saturation is. I think you have to be careful with buying those things online because you don't know how well they will work when at home. Well, you just don't know what you're getting in the mail. So, and the other thing is, I think if you feel like you're short of breath, you should be contacting your physician, and so they can see what would be the next steps, and if you need to come into the office to be seen, if you need a televisit, or if you need to go to the emergency department.
Okay, thank you. A couple of questions on the 14-day quarantine pyramid. I'll combine a couple of questions into one here. So first, is self-quarantine for 14 days still recommended if you have traveled from out of state? And then as kind of a follow-up to that, if I need to fly, should I quarantine for 14 days when I return?
Dr. McKinney?
I thought I was unmuted. Yeah, so currently we are telling patients that I guess the first question was if they fly, should they be quarantined? Can you repeat the question?
Yes, certainly. If I need to fly, should I quarantine for 14 days when I return?
Yeah, I mean, I guess I haven't had too many patients since it started really traveling, but I think definitely if you have symptoms, you should quarantine yourself. If you've been around anybody that could possibly have some symptoms, definitely you should quarantine yourself for 14 days. I would say right now, if you don't have to fly, I would advise against it. And if you don't have to travel, then don't, I would advise against that as well. But definitely symptoms, you should quarantine. Or if you're around anyone that has symptoms, you should quarantine yourself for 14 days.
The CDC periodically updates their guidance on travel. And what I would say is Milwaukee has already had community spread, so that risk of traveling within Milwaukee may be about the same as if you went to another community that had community spread. So some people don't think that you need to quarantine just with travel if you haven't been exposed to somebody who's positive. So I would check the Centers for Disease Control and Prevention website.
Okay, thank you. We have just about 5 minutes left. Next is, I need to regularly care for an elderly person. My partner is a clinician who's exposed to COVID patients. What can I do to make sure the person I care for remains safe and healthy? Should I stop visiting my partner to keep the transmission risk low?
I think that's a hard question, but a very good one. Because what happens is you want to keep your parent or whoever you're caring for safe, but at the same time, your significant other is being exposed to COVID positive patients. And I guess I'm kind of in that same situation because I have patients that's on my in-service patient list where they are COVID positive, and then I have to come home to my husband as well as my children. So I think you can definitely take some precautions. All of those things that we said before, washing your hands, and I think it just depends. You can get on the internet and find all different kind of things that you can do. Currently, what I do is I take a shower. I either take a shower at work, I change my clothes, I actually change my shoes, especially if it's a car where my husband and my children will be getting into. So I change my shoes, I wipe my shoes down. I try to keep my car as clean as possible and disinfect those areas. And then when I come home, I go straight to the shower. So I think you can definitely try to do everything to prevent, but if anyone comes up with any symptoms, then definitely I would say you should not be exposing the person that you're taking care of. You shouldn't be around them if your husband starts having symptoms or you become symptomatic.
Okay, thank you. And then lastly, there's 2 questions here regarding places beginning to reopen, whether it's this summer or in the fall, specifically in regards to schools and places of worship. So has there been discussion about testing for school staff as we consider reopening? And then finally, what guidance would you give to places of worship that are preparing to restart their activities?
I can start not with an answer to those, but just to say that I know my colleagues back at the Department of Health Services are working on guidance for those situations. And so please do check the DHS website because there will be guidance coming on those.
If you're interested, I think the Catholic Diocese of Milwaukee has some really good guidelines that other faith-based leaders are looking to as best practices. So I would look there. The schools, that's a tough question, and I'm not sure there's a really good answer yet.
Okay, thank you. I just want to remind everyone that you can download the 2 handouts from the handout panel. One is the slides that were presented this evening, and the other one is supplemental testing information. And so to wrap up our evening's webinar, I'm going to turn it back over to Ms. Brown.
Thank you, Dustin, and thank you to all of the attendees. Thank you for your questions, and again, thank you to all of the panelists for your time and the knowledge that you shared tonight. Please note that if we did not get to your question tonight, we are adding those to our FAQs on covid19.mcw.edu. Also note that the information shared tonight is available at that same website, covid19.mcw.edu, as an infographic. We will be doing another town hall next week, Monday, at the same time from 6 to 7 p.m. Thank you again for joining us. We will meet you We'll see you next week, and please stay well.
Thanks, Christy.
Thank you.
Bye, everyone.